It became very apparent to me over the years, but deeply imprinted upon my imagination, that there was something wrong with the way healthcare was being delivered.
I had heard about Caremore and Dr. Zinberg from when I was in a role at a previous job that we were competitors, and Caremore operated primarily in the Downey and Whittier areas at that time. And I would meet with our salespeople and say, how can we have sales everywhere in Southern California except Whittier and Downey, and let's put more salespeople in those areas? And our sales managers would say, there's no way you're going to get sales in that area because people are not going to leave Caremore.
I first heard about Caremore when I was working in the Obama administration on the implementation of the Affordable Care Act. And we were at CMS and we were looking for examples of organizations that were transforming healthcare. And I still remember it like it was yesterday. There was a week where all anyone was talking about was Caremore because they were so impressed by what they'd heard about. This was an organization that was focused on better managing chronic disease, taking care of the sickest of the sick, delaying progression of chronic disease to keep patients healthier longer. And it almost sounded like it was too good to be true.
I served as President Obama's Deputy Chief of Staff for Policy, and before that, as the Director of the White House Office of Health Reform and a counselor to the President. And in that capacity, I was the person who spearheaded the development and passage of the Affordable Care Act, working with the President and his team and with Leader Reid and Speaker Pelosi in the House and Senate. And that's how I first got acquainted with Caremore.
My initial impression of Caremore at the time I joined the company was that it was an innovative, patient-centered organization with a comprehensive relationship-based model for care. The founders of Caremore were true innovators in terms of building a model to transform healthcare.
Meeting Dr. Shelley Zinberg, that was an overwhelming first impression. He's a force. And sitting and talking with him and Don Furman, who was the chief medical officer at the time, about what they were trying to do. And mind you, this was not a meeting about numbers. This was not about what are the revenues, how much are you charging, et cetera. This was about what is your vision, how are you taking care of patients? And it was, I can still remember, you know, it's one of those spine-tingling moments where you thought, is it really possible to do this?
What made Caremore strikingly different for me is that they were one of the first organizations that passionately pursued the triple aim and could demonstrate that patient-centered, high-quality, affordable healthcare was truly achievable.
One of Dr. Zinberg's core traits was to constantly ask questions. And I think that's a big part of the Caremore magic, that we just keep asking questions. I like to think of the way we do things similar to the way the airline industry grew up. Every pilot that ever sits in one of those chairs has been phenomenally trained, but they have to go through a checklist every time they turn on that airplane because it's proven that even the best of them forget something. So they're constantly asking what went wrong, how can we make sure it never went wrong again, goes wrong again. And I think adopting that kind of culture is part of our magic.
You know, Caremore has always been ahead of its time in driving reinvention in our industry. I have every confidence that transformation of care delivery will continue, and that Caremore's name will be synonymous with innovation and care delivery for many generations to come.
As it relates to One Anthem and the ability to spread care more broadly, I think that One Anthem is going to definitely help facilitate that process across the company. I'm excited about it because, like I said, Caremore is the best at managing the chronically ill, and if we can effectively do that across the enterprise, it's going to create tremendous value for us.
I think the special sauce of this organization, if there is a special sauce, is the culture. And it's the thing that's hardest to replicate, it's the thing that's hardest to scale, but it's the thing that I think we've preserved between Dr. Zinberg to Liba and to me. I think it's the thing that we all are passionate about. We're all very different people. We've all brought different things to this organization, but I think it's the thing that we connect upon and share most in common, across all of us. And I feel lucky to be part of that legacy.